Well, the reason I'm doing this video is that I know people are going to look online just like I did. They're going to look on TikTok, look on YouTube, just like me. And I thought this is the one. They're good. I'm going to get it done. And what you read is not always what you've got, I can assure you. Terrible experience. Diane, the wife, had her teeth done at Liverpool, Evo, in 2019, I think it was. And she's never had a problem or anything. The reason we didn't go was financial. They were doing it at like 25%, but the old saying is you get what you pay for. About £5,000 gone, just gone. And it's just not worth it.
Dan was booked in, she had treatment with us in 2019. Everything went well and everything's been great since. She was actually due a checkup and hadn't shown up, so we rang to find out, you know, is everything okay? Can we get her rebooked in? Because maintenance and follow-up after treatment's a very important part of this treatment. It was then that Stephen answered and sort of explained what happened, that they'd gone out to Turkey. Dan had had her lower teeth removed, which at the time we refused to do because she actually wasn't suitable for it. The teeth were in too healthy a state and other things would have been better for her at the time.
And what was the communication like between you and the clinic leading up to the treatment day?
WhatsApp. Everything was done on WhatsApp.
They'd really only sent pictures over WhatsApp and had a conversation over WhatsApp, which I don't see how you can make a diagnosis or a proper assessment of what needs to be done via a text message.
Did you send any x-rays into them as well?
Nothing.
So no x-rays were?
No.
It's just not something that I think is appropriate and not something I'm actually even allowed to do as a clinician here in the UK.
It was a conveyor belt. We were in a hotel and the bus used to arrive 3 or 4 times a day taking people. And as one of them said, who was having trouble, they come for more victims, and we thought we were victims. The treatment was going to provide me with a full set of teeth on 4 implants that they put in. They took all my teeth out, which was quite brutal. It absolutely awful experience. We had the surgery done on the Monday, and I thought, well, that's fine, we've got it done. They said, come back on the Wednesday morning and you'll get your palate in. And 2 days later we went back and they gave me a denture in a box. It wouldn't even fit in. And they said, well, that's all we've got. I tried to put them in at a hotel, they just won't fit in. So I said, well, what do I do now? He says, well, you go home and hopefully in a couple of months' time, you'll be able to get them in. I said to them, why haven't I got a fixed palate? He says, well, sometimes it doesn't work. I says, well, my thoughts were that they were never going to fit on. That's what I thought, because it's not right. I still don't feel right now. It's 2 weeks later. I said to him, how can this happen to me? You're sending me home. I can't eat, I can't do anything. There was no aftercare. There's been no contact with these people at all. They've never been in touch, nothing.
Looking at the work that was done, Stephen had a good amount of bone to work with, and there was enough cortical, or what I would call strong bone, to work with to give him fixed teeth on the day. Looking at his surgery, you can see they'd struggled removing some of the teeth, because there was big bony defects where some of the larger rooted teeth were, and they'd attempted to graft this, and then you could then see this in the placements because they'd put the implants to avoid this essentially mess that had been made. And it's like hanging a picture on a wall. If the screw goes into the wall fine, you pop a picture on it and it will support the picture. If it doesn't go in correctly or you don't get it in the right place, then you can't utilize that and put teeth on it. And this is what's happened to Stephen. You know, it's all visible on the scan that the good areas of bone have been missed, essentially the bits that will provide that stability. Diane had some other issues with hers as well, as so the implants at the back were half in the bone and half out of the bone in an area just at the side of the tongue. And in here you've got some big arteries and vessels, so it can actually be very dangerous if this is not done properly and you just go straight through into the gums. You could cause a bleed that would raise the floor of the mouth and kill you. So that's the kind of level of planning that's required to do something like this properly.
When we got here we saw Simran, and I just said, well, we've buggered up here, and we felt a lot better when we left. He put his mind at ease. You know, we can do this, we can do that. You will get teeth. Another week, we're having the procedure done, and we've been looking forward to this day since we saw him.
Having done this procedure multiple times a day over the last 5 or 6 years with EvoDental, I've not once not been able to provide fixed teeth on the same day. It's over hundreds and hundreds of jaws. So I think it really comes down to, in this case, it's just not been planned correctly, and then they've executed a poor plan poorly. You don't really have any recourse when something like this happens abroad. Who do you contact? You know, we're heavily regulated in this country. We have certain standards that we have to meet. All this plays into keeping the patient safe, and that structure and framework isn't as robust out there. Now, it doesn't mean every Turkish dentist is going to do this, but certainly myself, I see this regularly enough to know that it is a common theme. You know, if this does happen, you know, we can be here to pick up the pieces.
It was a bad experience, a real bad one, and I wasn't the only one there in the hotel. We were all down there at night. Other people were complaining, not just about the implants, on other things they've had done. So it's not what you think, and I bitterly found that out.